Hello and welcome to today's show. I'm Jamie Smith, a cancer control specialist with the Kentucky Cancer Program. Today I'm joined by Dr. Patrick Withrow with Western Baptist Hospital. He has great expertise in heart health. Today we're going to discuss how to strengthen your heart health and also reduce your risk for cancer. Thanks for joining us today, Dr. Withrow.
Thank you very much for having me, Jamie.
If you wouldn't mind just maybe starting out and letting people know exactly what you're doing now over at Western Baptist Hospital and the things that you do in the community.
Well, my official title is Chief Medical Officer. That's a vice presidential position. There are like 4 or 5 vice presidents, and that's one of the positions. And also Medical Director of the Baptist Heart Center. That's my official capacity. And the job description is varied, but what that amounts to is attending to all of the medical staff. That's the physician, surgeon, problems and issues that come up with the hospital. And also, I think it's an important part of my job to educate the community and be involved in public health as well, in even some schools.
Right, and that's great. And we just talked a little bit beforehand. Definitely, you've made an impact on the community, and I bet everybody out there viewing has seen you once or twice before.
Well, hopefully a positive and important impact,
Yes.
for the future.
Yes, definitely. I think you've definitely increased the awareness on heart health in the community, and definitely raised some awareness on which people need to know, because heart disease, of course, is the #1 killer of all Americans.
It is.
So anything we can do to decrease those numbers would be great here in our community as well. First of all, let's talk about some of the risk factors that a person might have for heart disease. I know that there's numerous of them, but perhaps you can kind of tell us about the important ones.
Yeah, I refresh my memory every now and then because, there's a big long list of these things, and there's some of the risk factors that you can do something about and some that you can't do anything about. And, I'll just sort of go through these things. If you're a male, you have an increased risk early on. The females tend to catch up 10 years later. The older you are, the higher your risk. Family history is an important risk factor. If you're a female and you're postmenopausal, that's a risk factor. Ethnicity is important too. Blacks and Hispanics are at increased risk for vascular events than Caucasians. Smoking, diabetes, hypertension, high cholesterol, especially the bad cholesterol, which I like to remind people. I used to tell my patients LDL is bad because it's least desirable. Now that's not what it stands for. It's really low density, but they can remember that. Least desirable. LDL is bad because it's least desirable. HDL, that's good because it's highly desirable. I used to give that little pointer to my patients.
That's good because I never remember the difference between the two.
It is. I mean, it's very confusing. Stress and anger, that sort of thing. Now, everyone has stress. That's a part of life. But how you deal with it certainly is a risk factor. There are some individuals who have poor adaptation to their stress and anger, and that could definitely be a risk factor. And obesity, especially if you're 20% over your ideal body weight. Now, when we talk about risk factors, when I used to talk to my patients, I'd say, you can also call these accelerating factors. Because, the natural tendency is, you're born with a set of circumstances. You're born with, you're either male or female, and some of the things that you can't really change. But there's some of these risk factors which are actually accelerating factors. So if you smoke, if you're overweight, if your cholesterol's high, if you have uncontrolled diabetes or uncontrolled hypertension, all of these things accelerate the process. They're listed as risk factors, but truly they're accelerating factors.
And so we can help change some of those.
Absolutely.
Now, one thing too is stress, which you mentioned, is often what I think. We have some people, like I think of my husband especially as a police officer, and so sometimes with their job occupations, sometimes added stress onto that can then be a factor for them as well.
No question.
And so maybe that's some things too that people could work on too, on how to actually handle stress with your jobs and things like that.
That really is true. That's sort of an adaptive behavior. I mean, if you're under a stressful situation, to figure out ways that you can deal with it. One thing that I have learned in seeing patients for years and years and years is chronic, unrelenting, uncontrolled stress will age you faster than anything.
Yeah.
You know, it's the sense that, you know, you're in a situation, it's very stressful, and you cannot do anything about it. I mean, that will really aid you faster than anything, not only outside, but also inside.
I guess with the presidents, they show pictures before and after and how they've aged in just that short term of service because of the stress that they have on them.
Absolutely.
As the commander-in-chief of the country.
Absolutely.
Yeah, definitely. Well, that's some good factors for us to take into account. And then, of course, it's our responsibility to be able to take care of those accelerating factors that you mentioned on and how we can be proactive to change those.
To comment more on stress and being proactive, you know, the practical things that you can think about, you know, we talk about exercise all the time. That's a great stress reliever.
Oh, yes.
Exercise is. And, you know, I think if an individual can sort of do something for someone else, get out of themselves, you know, volunteer, do something nice for people.
Yes.
We're humans, a human touch. You know, if you have a pet that you're responsible for, or you're in a nurturing relationship, you know, if not a pet, with a friend, a spouse, that sort of thing. You know, and, you know, I said we're human, the human touch. Sex is, that's a stress reliever.
Yeah.
You know, so there's a lot of things that you can do positively to try to relieve and compensate for all the chronic stress you have.
I know after a day, sometimes if it's stressful for me, I can go home and see my little boy, and just his smile takes all the stress away from me.
Right.
His little hugs. So that's definitely true.
Absolutely.
We've talked about the risk factors and who's at risk for heart disease, and you mentioned in there women slowly later, but I've heard a lot about how women, it seems to affect more women, and is there a reason for that?
Ask me that one more time.
The reason why there's such a higher amount of women that are having heart disease, what is the reason for that?
Well, that's not really true.
Okay.
I think you can sum up the risks are, you know, that we typically, in the older textbooks, talked about heart disease is a man's disease. Well, that's not really true either. The point of it is, men tend to be affected by heart disease and vascular disease 10 years prior to females.
Okay.
But at that point in time, after 10 years, the curves tend to parallel.
Okay.
Now, if the woman is diabetic, all bets are off.
Okay.
She drops right down to the man's level.
Oh.
So a diabetic female has the same risk as a non-diabetic male. Now, if you throw in menopause, also, she drops back down more toward the male's curve. So women tend to be protected about 10 years longer. I think the thing that you've heard more about women is how they are somewhat, quote, atypical in their presentation. Because, you know, when I went to medical school, you know, they would, heart attacks, a man's disease, severe chest pain, you know, and the Levine sign where you clutch your fist on your chest and it radiates into your neck or down your arm and this sort of thing. Well, you know, all bets are off if you're trying to figure out a heart attack in a woman. Their symptoms are different. Either the perception of the symptoms they have are different, or the cardiologist is not smart enough to figure it out, or all the above.
Right.
You know, I just don't feel well today. You know, I'm kind of dizzy and short of breath. You know, now sometimes they can have the classic symptoms that a man has, but very frequently their symptoms are what we call atypical, or unlike what we're used to hearing from the man's typical description of a heart attack. So you have to be very, very suspicious.
Okay.
You know, even if, say, a female comes in who is a diabetic and their diabetes is out of control and they just don't feel well, they're fatigued, short of breath, that sort of thing, you know, why is all this going on? You know, you better look.
Right. And what about I've heard people talk about numbness or pain that goes into their jaw.
That's correct. The jaw and down the left arm, down the right arm, into the back occasionally. Yeah, these are also symptoms.
So somebody could be sitting at home and just have some numbness for a while and it go away, and they think that it was just maybe a muscle spasm. Could they think that?
They certainly can, and that's a good point. You know, symptoms that occur and then go away, oftentimes there's a false sense of security involved in that, and that is really true with a stroke. You know, we had talked about strokes early on, where I don't know if you want to get into this now.
Sure, go right ahead.
Okay. I think one of the important messages that I would like to get out to the public is the acronym FAST, F-A-S-T, FAST. So if your family member or friend develops facial asymmetry, that's the F, You know, like they try to smile, one side of the face goes up, they try to frown, one side doesn't move. That's the F, asymmetrical face, F for face. A, you say, can you raise both arms? And one goes up, one doesn't hardly go up, you know.
Right.
That's the A, you know, inability to use both arms equally.
Okay.
So F was face, A is arm. S would be speech. Just, you know, if they're acting funny, say Peter Piper picked a peck, or pickle peppers, or whatever, they can't speak. You know, there's difficulty in getting the words out. So if you have, that's the S. So F, face, A, arms, S, speech. And it comes down to T, you know, that's transport, call 911.
Okay.
So if an individual has that, you know, get worried, because there's a limited time that can be treated. So I would get that seen about. And what made me think of that was when you said they have symptoms and they go away.
Right.
Well, one thing that we know about vascular events, ischemic events, that is lack of blood flow either to the heart or to the brain, sometimes they occur and go away. That doesn't mean you're out of the woods. That doesn't mean it's gone forever. Typically, if you have pain and it goes away, you're going to have it again. And that's a preview of coming events. You know, that's what we call unstable angina, or chest pain, which is varied in its occurrence. It occurs at different times. Less activity brings it on. It's called unstable, and that leads to a heart attack. And with a stroke, we call that a TIA, or transient ischemic attack. Now, if you have a true transient ischemic attack, if you fail the FAST test and it goes away, typically you're going to have the big stroke within 48 hours. 50% of people will. So the point I want to make is, you know, just because whatever it was went away, that doesn't mean it's over with and gone. Investigate it. You know, I won't say it's an emergency, but it's an urgency.
Definitely. I know my father-in-law ended up having a heart attack driving down the road, and they'd been on vacation. They were driving back home, and he felt funny, and he kind of wanted to wait till he got back home. But my mother-in-law talked him into stopping at the local hospital, and he ended up going in. He was having a heart attack at that point in time. And
that's right.
So he ended up with a quadruple bypass and everything, but he's alive and well today, and he's amazing. Lord, I tell him he's a miracle every day.
The Lord was with him, because, you know, if sudden death occurs with a heart attack, it's because typically of ventricular fibrillation, and that is a lethal, unstable cardiac arrhythmia where instead of, you know, the lub-dub, you know, the ventricle fibrillates just like a sack of worms, ineffectively contracting. Takes blood away from the heart and the brain, and in 5 minutes you're dead.
Wow, and that's scary. It's nothing that you definitely want to play around with.
No.
And I know with my husband, and probably some other women out there have the same, it's often hard to get your husband to go to the doctor when they have some symptoms going on, and his dad's definitely the same way. So it's always one thing that you need is someone to be able to coach you and to kind of help you get the help that you need.
Right.
Because we even, you know, here locally we have a chest pain center and everything here locally that's available to people, and so the quicker we can get them there, the better, correct?
Absolutely. And, you know, a lot of folks say, I don't want to go in, it's going to be nothing, I'm going to be embarrassed. Good.
Y'all would rather have that, right?
Bless your heart. Congratulations.
Yeah.
You know, at least you didn't die at home.
Definitely, definitely. Well, definitely the technology is getting better too, and one thing that I think is really neat that you all have over at Baptist right now is the robot.
Right.
That's from the University of Louisville, and so maybe you want to talk about that for a few minutes when we talk about early detection and some of the technology.
Absolutely, absolutely. What I try to do is I try to frame the situation to the public that, you know, a heart attack is a blockage in an artery to the heart muscle, and once you have a blockage, which is typically a clot, you know, 80–90% of the time, the artery has a clot, so there's no blood flow to that heart muscle, and then it causes chest pain and your heart begins to die. And, you know, we've done a pretty good job of teaching heart attack, get it seen about, you know, get that clot out of there, because you have, you know, 6 hours, maybe more, you know, depending on the circumstance, to deal with it, to stop the damage. Well, a stroke, you need to think in terms of a similar situation. Instead of a stroke being just stroke, think of it as a brain attack.
Right.
Because the mechanism is typically the same. 80% of the time there's a clot which obstructs blood flow that carries oxygen and nutrients to the brain, except the brain is much more sensitive tissue. You have 3 and at most 4.5 hours to give medicine to dissolve that clot to stop a stroke.
Wow.
So if people think in terms of heart attack, same vascular event except it goes on with the heart, and brain attack, then you begin to understand the urgency of all this. So where are all the delays in treatment? If you only have 3 to 4.5 hours for a patient to be treated effectively to reverse what's about to happen, the devastating stroke, the delays are, the main one is what we talked about before, they're sitting home. It'll go away.
Right.
I'll be okay, just let me sit here another 3 or 4 hours. You know, so the idea is patients need to make a decision to get seen, because the sooner you can get seen, the more likely we are to be successful. We have a program right now where we are schooling 440 emergency medical technicians, the emergency medical service, to identify stroke patients, just like we've done with heart patients. You know, they can transmit their EKG from the ambulance to the Western Baptist emergency room, so we know we got a heart attack, and they can call the cath lab in before the ambulance ever gets there. Same thing with the stroke robot when we've partnered with the University of Louisville. The EMS people, hopefully we can get the patients to call the EMS service, call 911, and they've identified this patient looks like they're having a stroke, they can call ahead. So either we have a neurologist available, and fortunately these times, you know, we don't always have medical services 24/7, 365. Like we have some times where we don't have a neurologist on call, and that's why we've partnered with the University of Louisville Stroke Center.
Okay.
Dr. Kerry Rimmel and 5 other stroke physicians that have a diagnostic robot, which we have in our emergency room.
Okay.
This is a pretty interesting device. It stands about 5 feet 2 and weighs 200 pounds and is controlled from Louisville.
That's pretty neat.
So there's a screen on the front that actually the patient and family can look at, and there's a couple of cameras on top of the thing where the stroke neurologist can take a history from the patient and the family and observe a physical exam being performed on this patient. The CT scan of the head can be transmitted to Louisville, so the entire evaluation can take place from a telemedicine device to Louisville to make the decision, is this patient a candidate to receive clot dissolving therapy or not? The whole idea is to bring more patients into the time frame where they can be aggressively treated. Am I?
Yes.
You understand what I'm saying? So basically, our neurologists are the quarterbacks. If they're available and they can get there quickly, we don't use that tool. Well, all the robot is a tool. It's a timing tool. If they're not on call, or say they're across town involved in a procedure or something, get the robot, I'll be there as soon as I can. So that the whole evaluation can take place very quickly, and a decision can be made to either administer or do not administer thrombolytic, which is clot dissolving therapy to this patient, which is FDA approved. It's state-of-the-art treatment. And you know, if I were coming in or my family was coming in, this is what I would want them to have if they were having a thrombotic or clot stroke.
Okay. Well, that's definitely a neat technology added here to our area.
You know, and we're not unique in this. I mean, this has been done in, I think, Michigan. They have some rural areas where they have, I don't know, 14, 15 of these devices around in different emergency rooms, and they go to a central hub in Michigan. And the same thing is true with University of Louisville, because we have a great stroke center there. And if for some reason, you know, they see from the CT that there's something else going on, well, then they can advise, you know, basically send them on.
Right.
And they can be sent to Louisville or wherever they choose to go.
Right. Well, that's definitely neat, and having that expertise that's 3 hours away right here in our own backyard.
Key concept is patient education. And, you know, do not ignore this. And I've had so many patients who had the symptoms of an impending stroke, and it went away, and they said, everything's fine. They forgot about it. 2 days later, had the big one.
Right.
And I think I told you before, the importance of stroke is the number 3 cause of death in Kentucky and in the United States. It's the number 2 cause of why people are in a nursing home, and it's the number 1 cause of major irreversible disability.
Yeah. And those are just alarming statistics. You know, that's something that definitely we need to do a better job of educating people so that they become aware of those, and then also to be able to reduce their risk factors for that
Right.
as well. And that's what I'd like to talk about for just a few minutes.
Sure.
There are some things people can do. You've obviously mentioned the obvious, if they're smokers, to become, of course, to quit and become a non-smoker. And there's several different ways that people can do that, and Western Baptist offers some of those as well. If you want to talk briefly just about some of the things that Western Baptist offers.
Well, as you well know and you're involved in,
Yes.
Cooper Clayton smoking cessation,
Yes.
which I think is a very important thing. And you've actually mentioned a website on here that I think you're involved with, which is www.smokefree.gov.
Yes.
A lot of helpful hints there, and a 1-800 number you can also call.
Right.
And these, I'm sure these sources can give an individual an extensive look and sort of a slower look that they can kind of go through it. That's 1-800-QUIT-NOW.
Yes.
But there are some tools that we had talked about, you know, and actually I think there are 3 drugs, but 2 of them come to mind, and one is the nicotine substitution.
Right.
Because nicotine is an extremely addictive substance. Very difficult to get off of it. And so some of the nicotine patches and nicotine gums actually can help with withdrawal symptoms. You can sort of taper yourself down. And the other medicine is Chantix, which actually I think the success rate is 40 to 50% with Chantix use. And that's not a nicotine substitute, but that is a nicotine receptor blocker in the brain. And how that works is, and why nicotine is so addictive is, whenever you have nicotine in your brain, the nicotine receptors cause dopamine release, which is a pleasurable sensation, and that's where the addiction comes in.
Right.
And so if Chantix can block that, it can help blunt the effect, the addictive effect of cigarettes.
Right. And definitely if anybody's interested in that, we encourage them to talk to their doctor about that. And then of course the nicotine replacement therapy is available over the counter, that they can go to the local pharmacy and get that. And then also one of the obvious things is exercise. And Western Baptist has been a big promoter of the START program through the American Heart Association, and you've taken quite a big reign in that.
I have. I mean, that is so crucial. You know, one of the things that I deem is extremely important is workplace wellness, because we spend a lot of time
We do.
at work. And
Often more times at work than with our family.
that's really the truth. And as you look at how our jobs have changed over the course of years and years and years, we spend actually more time at work, and the type of work that we do is sedentary work.
Right.
And you know, given that, you know, the exercise that we get is just really not there. So workplace wellness is a good place to actually start an exercise program.
Yes.
And one of the things that we know, that if a company like Western Baptist is the largest employer in Western Kentucky now, if we can convince our employees to get involved in exercise and in modification of some bad health habits, what we've found that's within 3 to 5 years from the time you do that, insurance premiums begin to go down.
Definitely.
I mean, and it's a good thing for the health of the individual. It's a good thing for the bottom line of the company. And hopefully they'll take some of these messages home
Right.
to the kids.
Yes.
Because one of the things, my goodness, is childhood obesity.
It's on the rise.
Oh, it's, you know, there's 1/3 of our kids are either overweight or obese.
Right.
2/3 of our adults are overweight or obese. And the diabetes now, you know, the hypertension, all of it. You know, there's just so many things that are happening to the kids.
Yeah.
You know, we can't go on like this. You know, our industrialized society here in the United States has with it, it's going to be a decreased lifespan of our kids. And that's what I've tried to get the message out to schools. And actually I started doing this about 1.5 years ago, and I looked in the mirror one day and realized that I was probably 45 pounds overweight. So I said, "You're not very convincing, fat boy."
Practice what you preach.
I did. So I started doing that. I started working, you know, exercising regularly and really changing my diet, and you know, I feel a lot better.
And that's the other thing too, is diet. We get the convenience of fast foods, and sometimes, you know, it's quicker to go through the drive-thru than to sit down and eat dinner with your family and prepare it, but nutrition also plays an important part.
Huge. Nutrition plays a huge part. And that's an interesting point you bring up. It's been shown that if a family has meals together, they usually consume fewer calories.
Right.
And there's a lot to be said for portion size.
You're right about that.
You know, I mean, you can get away with eating all kinds of food if you just watch your portions.
Yeah.
And that's what, you know, if I had to say two things, it would be portion size and exercise. It's got to be both.
Right.
I mean, if you're eating like a pig, you can't do it with exercise alone.
Yeah, definitely. Well, I think we've talked about a lot of important information today, and as a history, I mean, you've seen this throughout your career, you know, numerous years you've spent in a practice, and you've educated patients over the years, and now you're educating the community. But what's the one key message you want the audience to take away today from this program?
What I would say would be personal responsibility. The one person that's most important in your health is you.
Yes. That's a very good point, and that's simple and to the point as well.
It really is. And one of the things that, you know, whenever I see some of our politicians talk about universal health care, covering everyone, what about a little personal responsibility? I mean, how does it make you feel if you see a 300-pound diabetic with hypertension smoking a cigarette, riding his motorcycle with no helmet? Yeah, you need insurance, paid for by the rest of us.
Yeah.
I think that makes a point to me.
Right.
You know, along with universal coverage, there should come universal responsibility.
Definitely, personal responsibility, and of course, you know your body better than anybody else.
Right.
So you need to take responsibility
Right.
for it. Well, Dr. Withrow, thank you for joining us today, and you've certainly given us a lot of information for us to be able to take back and make changes in our life, not only for a healthy heart, but also with the tobacco cessation and nutrition and exercise. Those are all things we can do to help reduce our risk for cancer as well,
Absolutely.
as long as heart disease. So thank you for joining us today, and if you have questions about heart disease or want to contact Western Baptist for more information about their programs, you can call them at 270-575-2918. And if you have any questions about today's show, don't hesitate to contact our office as well, the Kentucky Cancer Program, at 270-442-1310. Thanks for joining us today, and we'll see you next time.